Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwanitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on. Let's get between the sheets. Hey there, welcome back to Between the Sheets. Have a fun topic for you today. We're going to talk about masturbation. This is a topic that is taboo in many areas that a lot of people don't want to admit to, especially women. And I am just ready to kick that in the balls and let's have some fun with masturbation because everybody needs to know how to get off their best. And the best way for you to learn how to do that is to do it to yourself and figure out what works for you. And so I love the idea of masturbation. I think it is fantastic. It increases your own self-pleasure, your self-love, your ability to get off with your partner. You can do mutual masturbation with your partner if one of you isn't in the mood for penetration that night. So it's a really great thing. So let's get into it and let's start our topic today. So masturbation is the act of stimulating the genitals or other sensitive areas of the body for sexual pleasure. It is normal, it is healthy, and it is a part of sexual development. Masturbation is also a safer form of sex because it doesn't carry the risk of sexually transmitted infections or unplanned pregnancies. So if you're not up for that, maybe you may truly masturbate. It's great. It can also be a way to explore sexuality and learn about sexual responses, which can help communicate your needs to a partner. You know, I love communication. Masturbation is only a problem if it interferes with daily life or relationships. If this happens, it may be helpful to talk to a healthcare professional or sex therapist. I certainly see people for this in my own office, especially young men who are masturbating with porn frequently, and then they get a partner, and the sex with that partner is not necessarily the type of sex that they watch during their porn and masturbation sessions. Men also, you guys get real good at masturbating and getting yourself off in a particular way. And then you may not be able to achieve that with a partner if they're not doing that particular technique. So if it's becoming a problem, it's interfering with your daily life, meaning you're doing it so often that you can't get through your day of work or go to family functions or things like that because it's just such a priority for you, or if it's affecting your relationship and your sexual compatibility and ability with a partner, then you might want to get some help. So see your urologist, your primary care, sex therapist, somebody that you can talk to about it. Okay. So I found some fun statistics on masturbation. Prevalence, more men than women report masturbation. Is that meaning that more men masturbate than women? Maybe, but there's also more of an acceptance with male masturbation than there is female masturbation. And so maybe it's just that women are a little less inclined to report it. Although I will say, even in conversations with my own girlfriends, we talk about sex all the time. Masturbation is not one of the topics that gets talked about nearly enough. So get out there and have some fun. Prevalence, about 73.8% of men and 48.1% of women reporting masturbating. Men masturbate more frequently than women. There was a study done in Spain in 2023 that showed men masturbate on average 170 times a year, while women were masturbating an average of 90 times a year. So that's kind of interesting. Men are almost 100 times more than women, but hey, at least the women are getting theirs too. Masturbation is associated with many partnered sexual behaviors. It is common among people with higher education levels and social classes. Men had a study that showed that masturbation is also associated with condom use when they do have a partner. And for women, masturbation was more likely among women who reported more frequent vaginal sex, a greater repertoire of sexual activities, and more sexual partners in the last year than women who weren't masturbating. Masturbation has many benefits, mental and physical health benefits. It includes stress relief. Masturbation can help you relax and reduce your stress. It can help improve your sleep. It helps you fall asleep, which a lot of people struggle with. It can also provide pain relief. This is one of my favorite ones because the classic, I have a headache, I don't want to have sex tonight, whether you are a male or a female. Nope, doesn't work. Guess what? masturbation, sex, getting that orgasm, that helps with pain relief. That is going to help get your headache to go away. The orgasms release these endorphins. They are natural painkillers. Masturbation can also help with menstrual cramps and other aches and pains. Orgasms also release dopamine and oxytocin, which are feel-good hormones, happy hormones, pleasure hormones, and they can improve your mood. Masturbation helps you have better sex. You can learn more about your body and improve your sex life. It helps you define your boundaries. It helps you define what you like and don't like, what feels good and what doesn't. Masturbation improves your self-esteem, gives you a better body image, makes you feel good about yourself. It's pregnancy prevention, right? Can't get pregnant if you masturbate. Low risk of STIs. You're not going to get them unless you're using toys of somebody else and didn't clean them in between, something like that. Orgasms increase blood flow to the skin, which can make your skin glow. And it can also help with pregnancy symptom relief, like lower back pain when you masturbate. So very, very important things to do or side effects, positive side effects of masturbation. And so let's talk about some of the maybe tougher sides, right, of masturbation, or maybe the looked down upon side. So one of those areas that can make talking about masturbation and doing masturbation difficult is religion. It depends on your religion. It depends on your religion and your domination, and also your personal conviction. So Roman Catholics, Eastern Orthodox, Oriental Orthodox, and some Protestant Christians consider masturbation a sin. Many Protestant churches in both the Northern and Western European and some of the Protestant churches think that it's not a sin. So it depends on, again, your religion, your denomination, where you live, what is taken into account, and how the Bible is interpreted within your religion. A lot of scholars, theologians, believe that there is no explicit descriptions about masturbation in the Bible. The word masturbation is never specifically mentioned in the Bible or the Book of Mormon. And there are not any clear references to masturbation, making it good or bad. There are various passages that are held to implicitly condemn or approve masturbation, and then others disagree that there is not a clear condemnation of masturbation. So again, depending on your religion, your denomination, where you live, your pastor, all of those things. But I know that, growing up there, I remember hearing different religious viewpoints on it. And basically in my area, it was a sin. And so I just really want to get past that and not have people have that issue, because it is so beneficial, like on all the different things that we mentioned. So how do you get started if you're not comfortable with it, if you've never done it before? I have friends that don't masturbate regularly. It drives me crazy. I want them to have more fun in their life. It doesn't have to lead to orgasm, but it certainly can. Some people just want to learn their body better and just have a little bit of fun and enjoyment and pleasure time. Other people want that orgasm. So you can set the mood, right? Turn down the lights, maybe light some candles or an incense, or put on some relaxing music, whatever gets you in the mood to relax and to enjoy yourself. Some women or men may need lube. So making sure that you have the appropriate lube for what you're using, meaning do not use silicone with silicone toys. You want to use water-based. If you have a recurrent UTI issue, make sure you're using water-based. Some women are wet enough with their own stimulation or their partner stimulating them, and they don't need lube. Other people need it. If you're using toys, it might be really helpful as well, especially for like men using the sleeves to help with masturbation. Let your mind wander. Think about what you want to think about. Think about that hottie at the gym. Think about that single dad in the grocery store, that hot mom that you saw at the football game. If it was in Maryland, it might have been me. So let your mind wander and have some fun. Take your time. Don't rush masturbation. Allow yourself that time. My preference is in an empty house when no one is here, and I can just enjoy myself and not worry about somebody walking in or anything like that. Get yourself some toys, or use If you use a constant toy all the time, then use your hand. Give it some differences when you do it. Figure out what works well for you. You can consider using erotica or pornography. Some people prefer to read it. Some people prefer to listen, but with no visual. Some people want the visual as well. Definitely kind of changing up what you watch and when and how long and all of those things can be really helpful, so that you don't get stuck in a rut of what gets you off and only gets you off. Changing positions. If you're always standing or always laying down, maybe trying a different position. It'll give you some different sensations, get you a different way of a different angle of touching yourself, things like that. Move your hips. When you're having sex, you're moving a lot. If you're masturbating, mimic it. Do that. It can be kind of fun. It can add to it. And then certainly explore other erogenous zones. Our penis and our clitoris, vagina are not our only sex organs. Play with your nipples, rub your inner thigh. Some people have feet things, rub your feet. There's tons of nerve endings in your feet. You can rub, pinch, pull, squeeze, tag, all the things. And play around with different levels of touches and pressure and things like that. So lots of different things you can do with masturbation and having a lot of fun with it. For our vagina holders with masturbation, some fun orgasm facts for you. Women in their late 20s masturbate the most. And this was a study done by Indiana University. 20% of women have never masturbated. Those are the ladies I feel real bad for, and I really want to listen to this, so send this to them. Female masturbation is more accepted today than ever before. Masturbation is the quickest way in which to enjoy an orgasm and to have some reaching climax within only 2 minutes of solo play. And with their partner, it may take a lot longer of that. 4 out of 10 women prefer orgasming from masturbation as opposed to sex. The female orgasm lasts around 10 seconds. As we have talked about in other episodes, depending on the type of orgasm, it may last longer. Women can climax with the clitoris, the vagina, the anus, all the above, a combination of them. And not all masturbations have to end in an orgasm, and that's completely normal. About 90% of women prefer using a sex toy as opposed to their fingers. So I think that's pretty great. I love sex toys. I think they're fantastic, and there is such a plethora of them out there that you can find something that works for you. So if you want to masturbate as a female vagina holder, there's different types. You can do clitoral, vaginal, anal, a combination, or your erogenous zones. So clitoral, most people use their fingers to play with the clitoris, but vibrators and toys can also really help. The clitoral orgasm is a tingling sensation that you feel in your skin and in your brain. Vaginally, you can use fingers or a toy for penetration. You'll feel a bigger and deeper orgasm with this one. Your vaginal walls will throb. You'll feel it more internally. Anally, you can use your fingers or a toy. And right before you orgasm, you can feel a very intense need to urinate, but it's just the contractions of your anal sphincter. You're okay. The combination is any of the above: hands, fingers, toys in clitoris, vagina, anus. And you can get a really explosive orgasm with a combination. And then your other erogenous zones: touch, pinch, pull, squeeze, whatever. The other areas, some women can get to orgasm through these other areas. Some women need combinations. So let's talk about trying to get a clitoral orgasm. Lay on your back. It seems old-fashioned, but when it comes to stimulating your clitoris, this position is the best. So you lay on your back, maybe put a pillow under your head, maybe put a pillow under your low back, spread your legs, and you can rub your clitoris slow, fast, hard, soft, whatever feels good for you, probably changing it up, doing different things, different motions, all of that can help. Using a vibrator with different settings on it can help as well. The vaginal orgasm, for one thing that you can try that a lot of women don't try, is squatting instead of laying down or standing. Squatting gives you a little bit more face value with the toy to the skin contact. And it also puts you into hitting the G spot a little bit easier for when you're masturbating. And so you can kind of crouch down or sit on something where you're in kind of a squatting position. You can move up and down. You can use toys, you can massage, you can, again, all the touchings, all the speeds. The come hither motion is used a lot for the G-spot stimulation, and those can give you great orgasms. With the combination, again, anything with your fingers, toys, etc., that is using more than one body part. So you can use the same rhythm, different rhythms, switching up speeds between the two. One gets faster, one gets slower. So lots of different ways to play around with for getting a combination orgasm. And don't think just at vibrators. There's anal plugs, there's creams, there's nipple clamps, there's all kinds of different toys out there that can give you different stimulations. So that is really important when you're working through this, is to really get into figuring out what works best for you and enjoying it. And then you'll be able to talk to your partners about what you want them to do to you. So now let's switch gears and go to our penis holders. Some fun facts for male masturbation. Globally, 82% of men masturbate. 92% of American men masturbate. On average, the man masturbates 154 times a year, or about 3 times a week. 9%, so almost 10% of men masturbate almost daily. Men masturbate for different amounts of time. So less than 5 minutes is about 7% of men. Men who masturbate for 5 to 10 minutes, that's about 33% of men. 29% of men are doing the 10 to 20 minute range. The average masturbation time for men is about 14 minutes. Men masturbate about 68% more than women. 67% of heterosexual men in a relationship masturbate at least once a week. So it's okay. You don't have to have sex every time you want an orgasm. Sometimes your partner's not in the mood. Sometimes you're not in the mood for penetrative sex. Sometimes you just need to kick off some stress and just knock one out really quick and move on with your day. So I think that's perfectly acceptable and fine. And I love that statistic. Men aged 20 to 25 masturbate more frequently than any other age group. Men over the age of 70 masturbate less than any age group. 82% of people masturbate more in the winter. So, I mean, we're kind of bored and it gets dark early, I think. Most men prefer to masturbate in the evening. 23% of men say the couch is their favorite spot to masturbate. 80% of people prefer to masturbate in their bedroom. 6% of men masturbate at work. ADHD can increase your sexual desire and masturbation frequency. So some things for our guys to try: switching hands. You can change positions. You can switch hands. This gives you different sensations. You have different rhythms, different abilities. Maybe one hand is more coarse than the other, so you get different friction levels. There's one thing called the stranger technique, where you can sit on your hand until it kind of goes numb. And then use that hand so it kind of feels like a stranger. So that's kind of a fun little tip. And then if you're looking for something more adventurous, there is a technique of where you hold your penis up against your stomach and stroke the underneath side of the shaft with your non-dominant hand. That seems to give a little bit of an extra fun and something slightly different. You can try different strokes. Up and down is the tried and true way, but certainly going in different directions, changing the position of your hand, changing the speed, twisting strokes, different finger grips. There's lots of different things that you can do to kind of change up your stroke and sensation. Go beyond the penis, okay? There's more to your erogenous zones than just the penis. Play with your scrotum, play with your testicles. They have a lot of nerve endings in there. Play with your anus, lots of nerve endings there. You can stroke your inner thighs and other areas that are sensitive for you that can help increase your enjoyment and pleasure. And don't forget about the prostate. Okay, this is the male G-spot. It is a golden ticket to an intense full body experience, orgasm. And you can use this with a finger, you can use it with an anal toy, and you can massage the prostate. Your partner can massage the prostate for you. You can change the speed, the pressure, the motion, all of those things. It's an exciting one to try. I have had many male patients and friends tell me that they absolutely love a prostate orgasm. And this is not just for homosexual men. Heterosexual men like it too. So enjoy it, play with it, figure it out. You can certainly add in toys. There is fleshlights, pocket strokers, prostate stimulars, anal beads. There's all kinds of different toys out there. And you can have a lot of fun with that. And so definitely look at what's out there and try some different stuff. You can also try edging, which prolongs your play. So edging is drawing out your orgasm. So when you get really, really close, you stop. And then once you calm down a little bit more, you can start again, get yourself to almost climax, stop. And then, so that's called edging, getting yourself to the edge of orgasm and then bringing yourself back down. And you can kind of do that several times until you are ready to climax. That can also help you. There is research that shows that can help you last longer with penetrative sex as well. But it is kind of a fun thing for men that you can kind of play with when you are masturbating. So men always like to know, is it possible to have back-to-back orgasms? Men have a refractory period. After you ejaculate, you're inhibited to ejaculate for a period of time. The younger you are, it's usually much more close together. The older you are, that refractory period can get much longer, up to a day or two even. So yes, technically you can get very close together orgasms, but you do have this non-ejaculatory time frame called the refractory period. So you can certainly work on it. But yeah, it's definitely something that does change throughout your lifetime as well. For men to get an intense orgasm with masturbation is practice, practice, practice. You will find what works for you. You will find what toy, what position, what hand grip, all of the things. And so, and sometimes then you can teach your partner, like, hey, this works really well for me. Can you do this when you were doing foreplay? Can you do this when I get close to climax? Things like that. So it really allows you to get into that and talk about that as well. And then for anybody in anal orgasm, one thing that you can try is face down, like in the doggy style position. And that gives you more room to insert your fingers. You can do a toy, rubbing yourself. If you're on all fours with your face down, you can reach through the legs, you can reach behind. So you have a little bit more variability there. And that can give you some fun times as well. So you can start by massaging the outside and then gently working your way into the inside. It does take the anal sphincter a few seconds to relax. So just work with your body, breathe, and enjoy that. Adding to playtime, you can certainly try and do different things with your masturbation sessions. So figuring out what turns you on, you can sit in front of a mirror, play with yourself, look at yourself, watch what's happening. You can, put lube on yourself, see how hot it is to look all lubed up in the mirror. You can have your foreplay. You can have the main event. You can do whatever you want. It's your session. You can read a book that turns you on and masturbate while you're reading a book. You can watch a movie, anything like that. There's some really great kinky literature out there. We actually did a full episode on that earlier. You can go back and find that as well. I had an author on Gabby Salas, and she did a great job of kind of explaining all of this. So you can certainly, get this increase in libido, relieve your stress, explore your own sexual kinks safely, and figure out what you do and don't like, and go along that way. So I just really love the idea that you can explore yourself and you can increase your sexuality and your sexual experiences with yourself and your partner. I think it's super healthy. We talked about all the different health benefits from it. So get out there and masturbate. But first, let's talk about some fun little stories. It's time for my favorite segment of the show, Between the Sheets Shenanigans. We've got some great stories for you, and as always, the details of the stories will be changed so that you cannot identify who the owner of the story is. It might be my story, might be my friends or family members, or even a patient's story, but you're not going to be able to tell. Please send in your stories as well so we can shake up the details and share your stories. Send them into podcastbetweenthesheets@gmail.com. Let's tell some stories. So I had a friend who had never used a vibrator. We talked her into getting a vibrator. She now not only uses it for her own masturbation sessions, but with her partner as well. And her orgasms have increased immensely in the intensity of them. And she's really happy with that. I have talked about this before, but I have had friends who could not orgasm by partner orgasming for years and years and years. Penetrative sex just did not do it to them. Foreplay did not do it for them. And it wasn't until they masturbated and learned their own body on what they could do. I had a male friend that I knew that would spend hours a day masturbating. He had specific fetishes, things he liked, and it worked for him, but it got to the point where it was kind of starting to interfere with things. So he really did end up toning that back. I am still sure he does at least once a day, but I don't think he does the marathon sessions anymore. One of my favorite things is mutual masturbation. If you are not in the mood for penetrative sex, if there is something preventing you from having penetrative sex, you can mutually masturbate each other, whether you're using toys, whether you're just both laying there masturbating yourselves, but you're doing it together, or if you're masturbating your partner, they're masturbating you. There's lots of different things that you can do that way, and it's super fun. I have a lot of patients that do that. The men maybe aren't tolerant to the erection medications anymore, or the women have a lot of pain that we're working through. And so whether it's a period of time that they're not having penetrative sex or something that they've just decided is going to not work for them anymore, and they have found some really great ways to be intimate together during those times. So this episode is coming out right before November. And for any of you that know, a lot of men and some women participate in what's called No Nut November, meaning they try to go as long as they can without having an orgasm. So I would like to change that up for us because I love masturbating and orgasms and having people get the time of their lives and all of these health benefits. I think we should have the nuttiest November, and everyone should go out there and strive to have an orgasm every day in the month of November, whether it is with yourself or with a partner. So that is my challenge for you, that we are going to have a very happy and healthy November because we're going to be having a whole bunch of orgasms. So I hope you'll participate with me, and we'll do that. And have a great day. I can't wait to see you again next time on Between the Sheets. Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics Between the Sheets.